Our guest today is Dr. Kiper Nelson, MD, board-certified ophthalmologist and cataract and glaucoma surgeon at Southern Eye Center. Dr. Nelson, it's great to have you here.
It's great to be here.
Thank you. You know, there are a lot of people in our audience who are either personally affected by cataracts or they may have loved ones who have cataracts. What advice would you share with them?
That's a great question because cataracts are very common, and certainly, in the South, the southern part of the United States, more common due to the bright sunlight exposure and everything that we deal with. But cataracts basically are a disease of aging. And when you're born, the lens of your eye is crystal clear. As time goes by, as you get on into your 50s and 60s, it becomes less clear and more cloudy. And eventually it becomes cloudy enough that it starts to cause trouble with your vision. And those problems are typically noticed with difficulty with night driving, glare off of headlights and stoplights and things like that. Generally blurred vision, needing more light to read. There are very many symptoms, but they typically all get into visual changes.
That's very helpful, Dr. Nelson. I've been told that a great way to ask a surgeon for medical advice is to ask the doctor, if you had the same condition I have, in this case cataracts, what treatment options would you choose for yourself? What are your thoughts on this, Dr. Nelson?
You know, there are lots of different lens implant options today, and that's a blessing to have many choices. If I was told today that I had a cataract, or if I found a cataract in my brother or my mother today, I would strongly recommend to them the light adjustable lens. And the reason for that is, in my own case, this lens implant, there's really nothing else like it. You can adjust the power of the lens implant once it's in your eye. And so in cataract procedures, we take the cloudy cataract out and we put the lens implant in its place. This particular lens is the only lens that can be adjusted after that to achieve really perfect vision for that patient. In my case, as an eye surgeon, I really need perfection. I'm doing some very fine, detailed work all day, every day. And so that would definitely be my choice.
That's great news, Dr. Nelson. So basically what you're saying is this lens allows you to fine-tune and customize a patient's vision, perhaps in the same way that a tailor perfects someone's suit or even a wedding dress.
That's a great analogy, and it's exactly the same. Other lens implants are good, don't get me wrong, and with each advancement, they have gotten better over the last 22 years of my career. But this lens implant allows us to exactly tailor the power of the lens to meet that patient's needs. And so we can get that patient with the light adjustable lens their very best possible vision. And it's the difference between buying a suit off the rack, which you may very well know your size and it may do okay, but anybody who's had a finely tailored suit and knowing the difference in between the way those garments fit is it's a night and day difference, and we can set it up to just that patient's specifications.
That's excellent, Dr. Nelson. Also, I understand you were the first eye surgeon to place a light adjustable lens in the state of Mississippi, and as I understand it, no one has placed more light adjustable lenses in Mississippi than you. Is that correct?
Yeah, I mean, we're proud of that. At Southern Eye Center, we consider ourselves a center of excellence, and we stay on the cutting edge of technology. We really look for new technologies as they come out that, number one, will benefit our patients. And like I said, cataracts are a very common condition. And so, we feel like this is a big advancement that allows us to offer a big improvement to a large number of patients. And so we're very proud to have brought this technology to Mississippi and to be using it to benefit patients' lives.
Thank you for your time today, Dr. Nelson.
Thank you.